begin the meeting of the Health, Hospitals, and Social Services. Today is Tuesday, February 18th, and I do detect a quorum. And the first item on the agenda is Resolution 2020-198, sponsored by Mendez, Hurt, and Welsh, appropriates funds from the United States Department of Health and Human Services to the Metro Action Commission to support the Head Start program by funding a comprehensive child development program for disadvantaged children. So, can I have a thank you? Thank you very much. This is self-explanatory. We know what it is about, the Health Start, and we know that they do a great job over at Metro Action. So, anybody got any questions, concerns, issues, comments? All in favor?
Aye.
Any opposed? There being none, thank you so very much. We have Resolution 2020-199, Mendez, Hurt, and Welsh, which approves Amendment 6 to a contract with Vanderbilt University Medical Center and the Metro Board of Health to participate as a member site in the Centers for Disease Control Tuberculosis Epidemiologic Studies Consortium Studies.
Move. Second.
Thank you very much, Mr. Shaw.
That is a long-standing contract. The money starts from the CDC, it goes to Duke, it goes to Vanderbilt, and in essence, it pays for a Vanderbilt doctor to come to the health department in the TB clinic, and we get some medical care out of him, and then as a part of the consortium, all the data is aggregated in their epidemiological study.
Right, wonderful.
Good deal.
Great. Any comments, questions? All in favor?
Aye.
Any opposed? Thank you very much. The bill that we have is Allen, Hurt, and others, amends Chapter 10.18 of the Metro Code to prohibit vaping on hospital grounds and within the public right-of-way in the vicinity of hospital entrances. This is pretty much the same thing as we already have with cigarette smoking, and we're just changing this for vaping. Can I get a motion?
Second.
Thank you very much. Are there any questions concerning?
There's an amendment that adds the health department sites, I believe.
Oh, really?
Yes, ma'am.
Awesome.
It's all, the Board of Health is already part of it, but it'd be great to have it on the
Excellent.
code too.
Excellent.
So I hope we accept it as amended. Second.
Thank you very much. All in favor?
Aye.
Any opposed?
Not opposed. I just want to say thank y'all so much for bringing this. I think this is really important. I think that's really good legislation. I do have a question. I don't know if you may know. This may be not the appropriate setting for the question. Do we have that for schools also, where people can't vape going into the schools? I can check with MMPS to see.
I think the schools abide by the Non-Smoking Protection Act,
Okay.
which prevents smoking within a certain distance of an aperture, a window, or a door.
Okay.
I don't know. I know the Non-Smoking Protection Act does not include vaping.
Okay.
So I don't know if the schools have tried to adopt that for their purposes.
Okay. Thank you. That's something I'll look into.
Right.
Thank you.
Okay. Do you think we need to, or is it possible for us to
Amend it to add
again to
schools?
add the
Metro
schools?
property.
Or would it have to go through?
Oh, I like that.
Just
So
say Metro properties.
Right.
I like that. I wonder.
Because that would by default include Metro schools.
I'm terribly sorry to come late to the party, but I have a question about this, which is, are we mirroring what we do with cigarette smoking?
Yes,
Yes.
pretty much.
Thank you.
Pretty much. But Councilwoman Porterfield basically has opened it up asking about schools. And Councilman Hall is saying if we just indicate Metro properties, that will include schools and any other Metro properties for cigarette smoking and vaping, I guess. Yes.
Say something before you go. As a representative of the health department, anything that cuts down on smoking, we're for it. I would caution you that making it applicable to all Metro properties would be something that the state might frown on.
Is there
Council Lady Allen is coming in. You know, she's very thorough in her research, so she may actually be able to answer the question. We are talking about the vaping bill, wanting to know if it can include Metro schools, or if there is some,
The state law speaks specifically to hospitals and gives metropolitan government, well, it gives city government's the authority to extend the 50-foot barrier beyond that for hospitals, but it doesn't speak to schools.
Okay.
So maybe we should just pass this as amended and then work on separate legislation and partner with our state reps to see if we could pass some legislation, and that may be next session. If they don't already have anything on the books for this session, that may have to be next session, but.
That's a good idea, especially since we've been talking about trying to build relationships with that.
And I will point out that we are all invited to a reception with our state delegation on the
Thursday, right?
Yeah, Thursday. So I hope people will come, because that's an opportunity to meet them all and have some casual conversations about that stuff.
Can you buy me a nonstop flight on a jet from Michigan and back
I'll
that
see what I
night?
do.
Thank you. Can I say one more thing about this? Do we have any ordinances today with regards to cigarette smoking, or do all of our cigarette smoking laws by buildings, are they all coming from the state, or do we have some locally?
We have a version of this that we passed in 2012, I think, specifically about tobacco smoke outside of hospitals. And Metro already has a policy that's separate from this.
And this is a new ordinance we're
So
proposing?
all
or
we're
can we-
adding is the vaping component to
To that bill,
Yeah.
okay, I'm sorry that I've missed that, thank you, okay.
I will tell you that the legislature reserves to itself the right to pass any and all legislation with reference to the regulation of tobacco.
Okay,
Right.
all
And
right,
there is a
right.
bill.
And the Non-Smoker Protection Act allows this. In fact, it started with Vanderbilt because there's a public sidewalk right in front of the hospital. And they said, we got people standing right in front of the front door smoking. Can we extend this to the public right away within 50 feet? And that's where that came from. But it is allowed by the state law to do this at
Right.
healthcare facilities.
Good discussion.
We may look into just, the devil's always in the details. Specifically, when it refers to state law, is that directly connected to tobacco?
Currently it is. There's a bill going through the state now that says some things about vaping, and
It's an open question as to whether e-cigarettes and vaping, any kind of
And that's why I was asking that,
is
because,
covered by the Non-Smoker Protection Act.
you have to excuse me, I'm always looking to thread the needle, or not a loophole, but we'll go right up to the line on some stuff. If all the state law is pertaining to and based on tobacco, e-cigarettes being nicotine products but not tobacco-based, I'm willing to touch that and see if we get preempted. But I don't think we will, because they have legislation currently on the Hill that we could probably run simultaneous with. There's nothing wrong with crafting that. And if we have to defer to track with what they're doing, I think that would be okay. But nothing right now prevents us from doing that, because state law is specifically geared toward tobacco. And that's how young people have been doing the vaping, because it's not a tobacco-based product. It's just nicotine. And so that separates, it is splitting hairs, but I believe it would allow us the ability to do that.
And then now you also have CBD. So, those are additional things that we'll have to consider when people are smoking CBD. So, so
Move this as amended. I believe we had made a
We had
motion to
made
do
the point
that.
of move it as amended.
And then
Let's
we'll work on the
get
other.
Councilman Glover up to speed. We're talking about the vaping bill. Pretty much, it's just a mirror of what we've already done for cigarette smoking.
outside of hospitals.
Excuse me?
Outside of hospitals.
Just outside of the hospitals, okay.
Right, but we have an amendment to include Metro Health facilities, which are Lynch Public Health, Woodbine Public Health, South Nutrition Center, East Public Health Center, and Metro Animal Care and Control. And with that, we basically are just in discussion about it right now. We had some good discussion.
And again, I'm sorry, Chair, I was on the phone, I couldn't get off of it.
I clearly understand, but we have got the amendment that has been
Approve as amended.
approved. Now, do we want to vote on the bill?
Yes.
All in favor?
Aye.
Any opposed? There being none, the motion carries. Thank you very much. That is our agenda for today. I appreciate you all being here. Thank you.
Thank you.